ABF DNR Code Status Notes. Code Status Emergency. Procedures Medical Emergencies. Purpose: to outline procedures to be followed during a medical emergency, to establish guidelines for the initiation of cardiopulmonary resuscitation (CPR), and notification of emergency medical services. Attending physician, administrator, director of nursing and legal guardian family. Procedure: the staff will determine unresponsiveness of the resident. The staff will verbal call for help. In the event that the resident is found to be non-responsive, incoherent, has a significant change in medical status, without respirations or pulse, or is in imminent life-threatening danger, the charge nurse will not leave the resident until qualified personnel arrives, EMS arrives, their condition improves significantly, or the resident expires. The code status documentation will be kept in the hard copy of medical record and uploaded to the resident's electronic record under the Documents tab. 1. If DNR is ordered, the OHDNR form will be completed on universal purple paper and appropriately signed. 2. Other code status forms, such as the attachment U full L code form, will be on white paper, appropriately signed and uploaded to the resident's electronic record under the Documents tab. If the physician has ordered a DNR code status, it will be listed in the EMR under User-Defined Fields, in the section of Code Status. 1. If nothing is listed under User-Defined Fields, the resident is considered a full L code. All residents with unknown code status will be treated as a full L code, and heroic measures will be taken until otherwise determined by verification of no code status. The resident's attending physician is to be notified, and all attending physician orders will be followed. ABF DNR Code Status. Notes: Code Status Emergency Procedures Medical Emergencies. The registered or licensed nurse will assess the resident for breathing and pulse. If no active exchange of air or no carotid pulse is detected, the nurse will then direct staff. 1. Assess if resident is a full L code, or DNR. If the resident is not a full L code, then the doctor will be notified and comfort measures and physician orders will be followed. If CPR was initiated on a no-code resident due to an undetermined code status, the doctor will be notified and orders including discontinuing CPR will be followed. 2. Page cal a code blue overhead. 3. Before giving CPR, ensure the scene is safe before approaching the victim. 4. Direct staff to obtain an emergency crash cart and AED. Ask staff to bring secondary crash cart if staff available to do so. 5. Direct staff to obtain resident's chart. 6. Ensure the resident is on a hard flat surface to promote effective compressions by positioning. 7. Designate person to document timeline of events. If the resident is determined a full L code, then the nurse will direct a staff member to Cal L 911 with the resident's name and condition. The nurse will prepare the full L code resident for CPR as soon as possible and begin following CPR basic life support protocols, including 1. CPR with AED. 1. For witnessed adult cardiac arrest, when an AED is immediately available, the defibrillator should be applied and defibrillation, if indicated, be attempted as soon as possible. 2. For adults with unmonitored cardiac arrest, or for whom an AED is not immediately available, initiate CPR while the defibrillator equipment is being retrieved and applied, and that defibrillation, if indicated, be attempted as soon as the device is ready for use. ABF DNR Code Status Notes. Code Status. Emergency Procedures Medical Emergencies. CPR. 1. Per the AHA, the recommended sequence for a single rescuer is: the single rescuer is to initiate chest compressions before giving rescue breaths, CAB rather than ABC, to reduce delay to first compression. The single rescuer should begin CPR with 30 chest compressions followed by 2 breaths. 2. Compressing the chest at an adequate rate and depth, allowing complete chest recoil after each compression, minimizing interruptions in compressions, and avoiding excessive ventilation. 3. The recommended chest compression rate is 100 to 120 min, updated from at least 100 min. 4. Rescuers should, summary, A. Provide compressions at a rate of 100-120 min. B. Compress to a depth of at least 2 inches. 5 centimeters. C. Al low full L recoil after each compression. D. Minimize pauses in compressions. E. Ventilate adequately. 2 breaths after 30 compressions, each breath delivered over 1 second, each causing chest rise. The resident's attending physician is to be notified, and AL attending physician orders will L be fall load. The administrator and director of nursing of the facility will L be notified. The legal guardian family member will L be notified of the resident's condition and possible transfer to an acute care hospital. AL DNR no code residents will L have a black dot on the nameplate area of resident room door. Additional lie, the care plan and face sheet will L reflect the do not resuscitate order. 1. In the event that a resident's code status is do not resuscitate and they are found unresponsive, CPR and heroic measures will L be taken if the cause is unnatural or suspicious. ABF DNR code status notes, code status. Emergency procedures, medical emergencies. 2. AL residents with DNR status will L be re-evaluated annual lie. 3. In the event the resident's guardian will L not sign the code status form, the facility will L ensure the physician has reviewed with the resident's wishes, with the resident and physician and resident agree with DNR status. Mock code blues will L be conducted with nursing staff weekly by the DON, RCC designee to ensure. The social service director or designee will L complete a weekly audit of AL DNR residents as full lows. A. Ensure the OHDNR form is signed by the resident. If they are responsible, legal guardian and physician, a nurse practitioner cannot sign the OHDNR in place of the physician. On purple paper and uploaded to the resident's electronic record under the Documents tab. B. There is a black dot on the resident nameplate on the door. C. DNR is stated on the care plan and face sheet. D. There is an order from the physician stating the code status of DNR no code under the Orders tab in the electronic record. E. The resident's name is on the DNR list. F. The DNR list will L be updated weekly and PRN and placed on every crash cart and nurses station in a way that does not violate HIPAA.